Good afternoon to one and all. So myself Vigneshwari, lecturer, still Lakshmana College of Nursing. So today I'm going to take an interesting topic on vital signs. So in vital signs, I'm mainly going to deal with temperature. So from the nursing foundation subjects. So we'll see one by one. First, we'll see the introduction of vital signs. So normally the vital means it is very important. So sign means it is the something is which has happened. So it's an important thing which is already happening in our body. That is the vital signs. Vital signs are indicators of the efficient functioning of the body. It is a clinical procedure and a part of physical assessments. So vital signs mainly, it is very important things which we need to detect the body and what is temperature and pulse, respiration and blood pressure. These all the things which is comes under the vital signs. And it is very important in the physical assessments. So definition of vital signs, the temperature, pulse, respiration and blood pressure are called vital signs or cardinal signs. So vital signs otherwise called cardinal signs. These findings are governed by vital organs. So because our heart is giving the heart rate and our lungs which is responsible for respiration and our blood vessels which is responsible for blood pressure and our hypothalamus which is responsible for temperature. So these and all the vital organs, so it is considered as a vital organs are cardinal organs. That's why we are doing this procedure. And the purposes of the vital signs. To obtain baseline data about the patient's conditions for diagnostic purpose and for therapeutic purpose. So obtain baseline data about the patient conditions. So mainly, so if you know the patient's vital signs means it is very useful for detecting the patient's problems and the conditions. And for diagnostic procedure, if the patient is having the increased body temperature, definitely we can say the person is having the fever. So for the diagnostic evaluations, and if the person is having the difficulty in breathing, that is the breathing rate is decreased, and we can able to easily say the person is having any respiratory problem. So through this vital signs monitoring, and we can able to conclude whether the person is having the problem or not. So this is the purposes of vital signs. And guidelines for checking vital signs. So on admissions. So when and all we are checking this vital signs means, and when on admissions, so if the patient is getting admitted through the OPD or through the emergency department, so we should check the patient's vital signs after entering into the concerned ward or the OPD. So that is the on admission to obtain baseline data. When a client has a change in health status or report symptoms such as chest pain or fainting, if the patients came with the chest pain or fainting means immediately we need to check the patient's pulse rates and the heartbeats and also the temperatures and the breathing rates and blood pressures. And according to a nurse's or medical order, before and after the administration of certain medication, that could affect respiratory rate or blood pressure. That is the respiratory and that's the cardiovascular systems. So after administration of the cardiovascular medication or the respiratory medications, we need to assess the level of heart rate and breathing rate before and after administration of certain medications. And before and after surgery or an invasive diagnostic procedures, and before and after any nursing interventions that could affect the vital signs, example, amputations. So before moving from the bed to chair, wheelchair or bed to structure or structure to wheelchair, so that time the nurse has to monitor the patient's vital signs before and the after, because of the mobility can also change the patient's vital signs. According to the hospitals, other health institution policy, we need to check the vital signs properly. And the body temperature. Body temperature may be defined as a degree of heat maintained by the body, or it is the balance between the heat produced and the heat loss from the body and is measured by heat units called degrees. The body temperature can measure either the degree or the Celsius. That's the Celsius or the Fahrenheit. So if the body temperatures measuring by the Celsius means that is a 37 degrees Celsius is the normal. And if the body temperature is measured by the Fahrenheit, that is a 98.6 degree Fahrenheit. So this is the heat which is produced in the body itself. That can be measured by the monitoring the temperatures through the thermometer. And two kinds of body temperature. First one is the core temperature. It is the temperature of the deep tissues of the body such as cranial, thoracic, abdominal and pelvic cavity. It remains relatively constant. So it is a core temperature. Core temperature means we are measuring the temperatures in deep of cranial, thoracic, abdominal and pelvic cavity. So surface temperature. It is the temperature of the skin, subcutaneous tissue and fat. It rises and falls in response to the environment. So according to the environment, the patient's body temperature is getting altered. That is the skin temperature, subcutaneous tissue, fat temperatures. It is a surface temperature, core temperature and surface temperature. Then we'll see the physiology of body temperature. So ways of heat production in the body. So how the heat production is functioning in the body, basal metabolic rate. It is the rate of energy utilization in the body required to maintain essential activities such as breathing. Metabolic rate decreases with age. In general, the younger the person, the higher the BMR. So if the person is the younger, the BMR and the basal metabolic rate is getting increased. And the muscle activity and including shivering increases the metabolic rate. And thyroxine output, increased thyroxine output increase the rate of cellular metabolism throughout the body. And the epinephrine or the norepinephrine and sympathetic stimulation also immediately increase the rate of cellular metabolism in many body tissues. And the fever, it increases the cellular metabolic rate, thus increases the body temperature further. And ways of heat loss from the body. So through the skin, first one is the radiation. So radiation, it is a transfer of heat from the surface of one object to the surface of another without contact between the two objects. So if the wood is burning means through the burning of the wood, the temperature is getting passes from the wood to the persons. That is the radiations and without contact between the two objects, mostly in the form of infrared rays. And the second one is the conduction. It is the transfer of heat from one molecule to another molecule of a lower temperature with contact. So conduction, it is because of any object through the molecule, it is the heat can be transferred. That is the conduction. So first one is the radiation and second one is the conduction. So it's a radiation in the sense it's a transferring the heat from one surface to another surface and conduction through any object. And convection, here you can see the convection. So it is a depression of heat by air currents. Body usually has a small amount of warm air adjacent to it. This warm air rises and is replaced by cool air. And so people always lose the small amount of heat through convection. And the evaporation, the continuous evaporation of moisture from the respiratory tract and from the mucosa of mouth and from the skin. And through the lungs, temperature of the air which is taken to the lungs is lower than that of body temperature. On entering respiratory tract, it is warm to that of the body temperature by absorbing heat from the lung tissue. As the individual breathes out, the warmed air is lost through the expired air. And through the kidneys secretes urine which is warmed by the heat taken from the body, and the urine excreted, the heat is also lost from body. So through the bowels, the feces that is formed in the bowels absorb heat from the body. So when an individual defecates, the heat is also lost from the body. So factors affecting body temperature. So what are the things which is affecting the temperature? Body temperature means age, gender, time, circadian rhythm, stress, drug and alcohol, exercises, hormone, illness, and food and fluid intake and environment. So age. So age, when compared to the old age, the children are more easy to get the increased body temperature, and gender. When compared to the male, the female are more prone to get the increased level of the temperature because of the hormonal changes and the time. So sometimes the temperatures will increase in the during the night time and it may be decreased in the daytime. And circadian rhythm. So the most of the persons may have the intermittent or the remittance and the types of the rhythms of the fevers and the stress. So most of the stress will not decrease the body temperatures and drug and alcohol. So most of the some of the drugs will cause the increased body temperature and alcohol also cause the increased body temperature. And the exercise, so most of the persons, if after the getting the exercise may have the increased body temperatures and the hormones. So due to the hormonal changes, particularly in women, may have the increased body temperatures and the illness and some any other infections or any invading of the microorganisms into the body also cause the increased body temperatures and will not reduce the body temperatures and food and fluid intake and some of the food which is caused the food poisoning and it causes the triggering of the hypothalamus and increasing temperature of the body and the environment. So due in the cold weather or the summers season, the person may have the altered body temperature. So this is the factors affecting body temperature. Regulation of body temperature. How can we regulate the body temperatures and how the body is getting regulating the temperature? So sensory receptors in the skin. Skin has more receptor for cold than warm, and these skin sensors detecting cold more efficiently than warm. Three physiological processes in the regulation of body temperature. Shivering increases heat production. Sweating is inhibited to decrease heat loss, and vasoconstriction decreases heat loss. So when your blood vessel is constricted, that time the heat is getting lost. So sweating also is inhibited to decreased heat loss. The integrator system, the center is located in hypothalamus. When the sensor in the hypothalamus detect heat, they send out signals intended to reduce the temperature by decreasing heat production and increasing heat loss. So hypothalamus is the regulating system of the body, so which is regulating the body temperatures and is getting the signals to regulating the temperature of the body. The effector system, cold sensitive receptors are stimulated effectors as vasoconstrictions, shivering and release of epinephrine, which increases cellular metabolism and hence heat production. Warm sensitive receptors are stimulated effector system send out signals that initiate sweating and vasodilation. Sites for checking temperature and we can check through the oral and rectal and axillary and tympanic. So these are the sites we can check the body temperatures. First is the thermometer. It is an instrument used to measure the body temperatures and it is available in both Fahrenheit and Celsius scales. And it has two parts, a bulb containing mercury and stem which mercury can raise. So this is the thermometer which can be used for measuring the body temperature. So it can be a manual and a digital. And stem is a graduated scale representing the degree of temperature. Lowest 35 degrees Celsius or 94 degree Fahrenheit. Highest is 42 degrees Celsius or 108 degree Fahrenheit. Oral thermometer bulb is long and slender. Rectal thermometer is short and rounded. So infrared thermometer sends the body heat in the form of infrared energy. So types of thermometer. So thermometer, it has three types. So glass thermometer, the mercury expands in response to heat, and infrared tympanic ear thermometer, sensor, probe shaped like otoscope, and electronic thermometer, heat sensitive probe reads in seconds. So nowadays we are using the electronic thermometers in recent days, and we can use it rarely the glass thermometer. So these are the three thermometers we can using in the ward sides. And this is the oral glass thermometer, oral digital thermometer, rectal glass thermometer, rectal digital thermometer. And parts of thermometer. So this is the bulb and mercury in shaft, and this is the stem. So where you can measure, it's a mercury in shaft, we can measure, and the place and the bulb is placed on the underarm or the oral or the rectal region. So this is the parts of thermometer, and this is the electrical thermometer and the tympanic thermometer. In the electrical thermometer, the only one button there is, and battery cap, and easy to read the LCD display, and highly sensitive tip for clinical accurate measurements. And this is the flexible tip where you can flex. And this is the tympanic, infrared tympanic thermometer, and where we can rarely using nowadays. And the measurement of body temperature conversion formula, and convert Celsius to Fahrenheit. So F is equal to Celsius. F means it's a Fahrenheit, is equal to Celsius into 9 by 5 plus 32. For example, convert 37 Celsius degree to Fahrenheit, and Fahrenheit is equal to 37 into 9 by 5 plus 32. Fahrenheit is equal to 66.6 plus 32. Fahrenheit is equal to 98.6 degree Fahrenheit. And convert Fahrenheit to Celsius. Celsius is equal to Fahrenheit minus 32 into 5 by 9. For example, convert 98.6 Fahrenheit to Celsius. Celsius is equal to 98.6 minus 32 into 5 by 9. And Celsius is equal to 66.6 into 5 by 9. Celsius is equal to 37 degree Celsius. So assessment of body temperature. So how can we assess the body temperature? Means the body temperature will be measured orally. So it is the most common site for temperature measurements. So oral method, the oral cavity temperature is considered to be reliable when the thermometer is placed posterior into the sublingual pocket. So this landmark is close to the sublingual artery. So this site tracks changes in core body temperature. So normal temperature ranges from 97.6 degree to 99.6 degree Fahrenheit. That is a 36.5 degree to 37.5 degree Celsius. So this is the advantages and disadvantages of the oral method. So advantages, there is a good blood supply under the tongue. Why we are placing the thermometer under the oral means, so there may be a good blood supply, more or less correct temperature can be recorded, and less chance for the bulb coming in contact with the outside air, and no privacy is needed. And disadvantages, there is a possibility of recording false temperature as the nurse may not know whether the bulb of the temperature is in place. The children or the insensible persons may bite the temperature, and there is possibility of cross infections if thermometers are adequately or not adequately disinfected. The patient will get tired if thermometer is kept for a long time. Patients will get the bad taste of the disinfectant if the disinfectant is not removed completely. So contraindications, the patients who cannot follow instructions to keep their mouth closed, and children below 7 years old, and epileptic or mentally ill patients, and unconscious patients, client receiving oxygen, and client with persistent cough, and patients who are uncooperative or in severe pain, and surgery of the mouth, and if the patient has nasal or gastric tubes in place. So in rectal method, advantages, it is used when the oral method is contraindicated, and most reliable and accurate. Rectum contain large amount of blood supply. And disadvantages, the patients need privacy, and there is possibility of cross-infection if thermometers are not adequately disinfected, and needs lubrication of the bulb. And if the rectum is loaded with fecal matter, we get a false reading. And contraindications, patients after rectal surgery and any rectal pathology acute cardiac patients, and the patients having diarrhea and reduced platelet count. So these are all the contraindications of oral and rectal method. And axillary method, it is safe and non-invasive, and it is a preferred site for measuring temperatures in infants and children. And temperature is measured in the axilla by placing the thermometer in the central portions and adducting the arm close to the chest wall, and should add 0.5 degree Celsius to the actual reading. And indications: oral inflammations, clients recovering from oral surgery, mouth breathers. And advantages: less discomfort to the patients, and taking hot or cold drinks will not affect the temperature reading, and the patient does not get the ill taste of the disinfectant, and the children's and the other children's and others patients who are not able to hold the thermometer in mouth, and this method can be used effectively. And the disadvantages: presence of moisture can give false reading, and least accurate and least reliable method. And if the thermometer is not placed correctly, the bulb of the thermometer may go beyond the axilla and remains in the air, may give a false reading. And contraindications: any surgery or lesions in the axilla, we should not do this. And tympanic method, so advantages: it reflects the core body temperatures, and is easily accessible and permits rapid temperature reading in pediatric and unconscious patients, and it is very fast method to 1 to 2 seconds. And disadvantages: it may be uncomfortable and risk of injuring the membrane, and presence of cerumen can affect the reading, and right and left side measurement may differ. Equipments for assessment of body temperatures. First one is thermometer to measure the temperature, and a small bubble with cotton balls to wipe thermometer, and paper bag and kidney tray to discard the soiled swabs, and lubricant for easy insertions and to prevent injury. A bottle with disinfectant solution Dettol, that's a 1:40, and Savlon, that is 1:20, and for disinfection. A bottle with clean water to clean thermometer, pen, recording chart, and the record the temperature. So this is the equipment for assessing the body temperature. So before that, we can discuss about the procedure of the body temperatures. So in the procedure, so we have to advise the patients to maintain a good position. It may be the supine positions, or the sitting positions, or the Fowler's position. Any position the patients can maintain, and we'll see one by one. So in the oral temperature, that the thermometer can be placed under the sublingual region. Before that, we have to explain the procedure to the patient and ask the patient to sit in the to maintain the sitting positions or the semi-Fowler's position, and we have to place the thermometer under the sublingual region and wait for a few minutes. And after the few minutes, we have to reading the values. And the rectal method, so ask the patients to maintain the niches position, otherwise ask the patient to maintain side lateral positions, and ask the patient to lie in the comfortable positions, and we have to insert the thermometers into the rectal region and wait for the few seconds for the reading, and after the few seconds we have to measure the readings. And the axillary method, as we all know, because nowadays we are using this axillary methods only. So ask the patients to lie in any comfortable positions, and we have to place the thermometers under the axillary region. So after the few minutes or the few seconds, we have to measure the temperature, and we have to add 0.5 degrees Celsius to the actual reading. And the tympanic membrane, so maintain the patient has to maintain the normal supine positions, otherwise the sitting position or the Fowler's position, and we have to place the this type of thermometers into infrared thermometer into the tympanic membrane, and it can measures easily, and after that we have to measure the readings. So this is the types of body temperatures, te techniques and the equipments, and you can use. And the references is the Berman's, it's a Coisier, it's a GL Fundamentals of Nursing 10th editions, and Portland Pay. So it is the Fundamentals of Nursing books, South Asian editions, and it is the 9th editions. And Jacob Annama, this is the 2015, the edition was, and the clinical nursing procedures, the arts of nursing practice. So this book also you can refer, and there are so many websites are there to check the content, and this is the only contents. These are the books you can refer for the temperatures, and particularly the vital signs. So not only the vital signs is very important, and the vital organ is very important. Vital organs only show the vital signs of the body. So temperatures is mainly responsible for all the process. If the person is having any other cardiac problem, or any septicemia, or any other breathlessness problem, anything which is happening in the body, so the mainly affect the hypothalamus, because hypothalamus is a controlling system of the body, and which is mainly responsible for the temperatures. So these are the things we need to see. So the summary and the conclusion. And first, we saw the introductions and the definition. That's mainly the vital signs of the temperature and purposes of the temperatures and guidelines for checking vital signs and body temperature. The normal value of the body temperature is in Fahrenheit 98.6 degree and the Celsius 37 degrees Celsius. And two kinds of body temperature we have seen, that's the core temperature, surface temperature, and physiology of body temperature, that's a basal metabolic rate and muscle activity and thyroxine output and epinephrine or non-epinephrine and sympathetic stimulations and fever and waves of heat loss from the body through the skin, radiations, conductions, convection and evaporation through the lungs and through the kidneys, through the bowels, and factors affecting temperature as we all saw before: age, gender, temperature, circadian rhythm, stress, drug and alcohol, exercise, hormone, illness, food and intake, and environment. So regulation of body temperature we had seen, sensory receptors in the skin, the integrator system, and effector systems. And sites for checking temperature: oral, rectal, axillary, and tympanic. But more we are referring the oral. And it is an instruments used to measure the body temperatures, as we all know easily. And types of thermometer, there are three types of thermometer: glass thermometer, infrared tympanic ear thermometer, and electronic thermometers. And parts of thermometer, as we discussed before, and measurement of body temperature, it is the converting Celsius to Fahrenheit and convert Fahrenheit to Celsius. And assessment of body temperatures, and first one is the oral method, and advantages and disadvantages, and its contraindications, and rectal method, advantages, disadvantages, and its contraindications, and axillary method, advantages, disadvantages, and contraindications, tympanic method, advantages and disadvantages, equipments for assessment of body temperatures. At last is the reference we have seen. So, dear students, I hope you all have understood about the topic of the temperature. So that's a vital signs. So go through. So if any doubt, let me know. So I will explain to you in deeply. So tomorrow you have to read and come before start taking the another topic. I will ask some questions. And this is what you have to go through in your home. This is your homework. And write one assignments regarding draw and label the part of the thermometers. There are three types of thermometers I have explained to you. So go and do the assignments of regarding draw and label parts of thermometers. I hope you have understood my topic, and tomorrow or next another day we'll see an excellent another topic. So thank you students for your valuable timings. Thank you so much.